Hi everyone, welcome to today's episode of Aesthetics and Wellness by Dr Yusra. On today's episode, I have the amazing, incredible author, writer, motivational speaker, performer, Sophie Lee. If you haven't heard her story, you are in for a ride. Strap in. We go through all kinds of things. We talk about trauma, childhood, racism, being a fire breather, and healing from burns. Enjoy. Welcome to today's podcast. I am so excited to have you on. Guys, today I have the amazing Sophie Lee. She is a performer and has an incredible background of performing arts, but unfortunately had a bit of an accident, which we're going to talk about today. But this was the start of a new trajectory, a new life, so to speak. And she has since become a motivational speaker and an author. She's recently written a book called In My Skin. And I am so delighted to have you because I know you're just an abundance of knowledge and inspiration. And I'm excited to be in your energy. Thank you so much for coming.
Thank you for having me. I'm so sorry. It took so long for me to get here.
I know I had to harass you to bring you here.
You tie me down now. We're here.
Tie you down.
We're here.
I think the last time I saw you was when you were in the clinic for the launch of one of our treatments. And you're so open and so honest about your journey. And I'm so grateful that you're on here and you're happy to talk about your journey.
No, I think being in your energy makes me so comfortable to talk about those things. You know, I feel like your energy is so open and inviting, and it makes me feel like I can speak openly to you.
I feel the same about
judged.
You. I think the whole world feels the same about you, Sophie.
Thank you.
So for those of our listeners who don't know about your story, I'm going to bring them on a journey, and I want to take it right back to how it all began for you. Are you happy to talk about your journey?
Of course, guys, we're going on an adventure today.
We're going on an adventure. Strap in. It's a long ride. It's a really amazing story. So tell me all about where you came from and your accident, if you don't mind.
So I'm originally a dancer, performing arts. That's my background. And I've grown up wanting to be a dancer my whole life. Since the age of 3, basically, I went into training. And one of my greatest inspirations was my grandma. She was a character. And I feel like me, especially coming from an Asian background, I feel so blessed that I was able to just express myself rather than be pressured into a line of work that I wasn't passionate about. So I've always been, encouraged to follow my dreams. And my mum especially as well. And my grandma really championed the journey of just be you, follow your dreams, do what makes you happy. And for me, dance was that outlet for me. I grew up it was hard because I lived in China for the first part of my life until I was like 3, 4. And then when I came to England, I didn't know any English, didn't know any of the culture. And it was such a huge culture shock for me. Yeah. And especially because, back when I was in school, racism was just rife. It was just so... It was very intense.
Isn't that sad? Was that in Manchester?
So that was in Darwin, in Lancashire.
Okay.
And I think because we don't have the awareness, they didn't have the awareness back then that they do now of, knowing the things that you say are going to be so harmful to a child. So I grew up really racially bullied, and yeah. And I was the only Chinese girl in my school. So I felt like I was very much the outcast and I didn't know where I belonged, really. So dance was my outlet. I could just be myself.
Did people make comments about your appearance?
All the time. I wrote in my book, actually, about one incident when I was literally 8 years old. You're a baby then, You're still learning your way. And my group of friends one day didn't want to sit next to me, be near me, because I had chinky germs and I was dirty. And if they were going to come near me, then I was going to give them these germs. Now, obviously, I was absolutely devastated.
Of course.
Ran to my mother. I was like, Mommy, what's wrong with me? I can't go to school anymore because the kids don't want to go near me. And I was so upset. And obviously, now I look back and I just think, how awful. But for me, it was like my whole world just crumbled.
Yeah.
And you having kids,
I know. I mean,
awful.
I'm from an Arab background. And recently I had to navigate that kind of thing with my daughter because my daughter came home and said to me, Mama, I'm not beautiful. I've got brown skin. And
no.
Yes. And we go to a school that is not very multicultural in its
Right.
background.
Me too. That was my background.
Whereas plus I think she's, she doesn't have her siblings in that school. She is the only girl. I have one daughter. Whereas I think I was a bit more sheltered because I was one of 4 and I had my sister. And so at least we looked alike.
Yeah.
But I was born in Scotland, and Scotland was not multicultural at that time. And then I came to London because it was multicultural. My parents wanted us to be around a community that was,
more accepting,
more
and
varied.
more norm to your culture.
Yeah, so you didn't look different or feel different. The only time that I really started to feel different is when society started to treat me different, and that was after 9/11. But that's a whole other story.
Yeah.
So I had to contend with that recently when my daughter came back saying that, and we had the talk about how all skin colors are beautiful, but it sticks, and they say sticks and stone may break my bones, but words will never leave me. And actually, the power of words.
I say this all the time. In school, one thing I say is, I show them a picture of me, the children, and I say, would you bully this girl? And the picture of me is me with all my scars, my tumors and things. And first thing anyone says is no. No. And I say, well, why would you say mean things to someone that doesn't have scars on their face, that doesn't show that they're hurting, that doesn't show physical signs that they're going through a tough time? Because, you don't know what kind of household these kids are going back to. Your friends might be going back to a very turbulent household. And some of the things that you say, that hurts their heart. They hold their scars in their heart. And I think as we've navigated as well into the aesthetic industry, I've grown to learn a lot about how you look. Are you trying to alter your looks, or are you actually trying to make yourself feel beautiful? Is it validation? Is it because you're searching for changing your whole look?
Yeah.
Like, I've had so many of these conversations, and I love that I'm having this conversation with yourself, an aesthetic practitioner who sees day in, day out, women come to you to talk about tweaks, this, that.
Yeah, I think that's a really interesting conversation, because I think a lot of people do think that when you're seeking to have treatments, it's like, oh, well, why are you not well aligned? And what about self-acceptance? And whilst I understand that, I think I always say, we don't have stigma when people are having their teeth done, right? There's no, well, why are you getting your hair cut? Or why are you getting your hair dyed? Or why are you getting your teeth straightened? But as soon as it's the face, there's stigma associated with it, and there's judgment. And actually, there's no place in society for that, in my opinion.
Same.
And beauty is a spectrum. And of course, there is a large spectrum. We can talk about risk, and we can talk about how far someone can go. We can talk about normalization or distortion, etc. But I think that people should be empowered to seek care where it positively impacts their self-esteem. And if there's something that is negatively impacting them, then they should be able to unapologetically seek care.
Of course. And it's such a shame that we didn't have these conversations when we were younger.
I know.
So, but in a way, it's good that we're here to lead that path.
Lead the way, change the narrative. So I want to ask you, are you an only child?
I was an only child until I was 7 years old.
Okay.
So that's why I completely can empathize with your daughter, and I know how she feels, because you just feel like, I don't have a big brother, I don't have a big sister to protect me.
Yeah.
I don't look the same as anyone else other than my mum and dad, but they're not coming to school.
Yeah.
They're not coming to school with me.
Yeah.
And so, I think I had to really kind of understand that being different is okay. And my mum, she, as soon as she heard these racist comments, racism is learnt.
Exactly.
It's taught.
Yes.
You're not born racist. No one is born racist.
Yeah.
Ever.
Yeah.
And so she stormed into the school and said, we need a meeting right now.
Yeah.
Parents, children, everyone. And she explained what racism was. And that's the first time I ever fully understood indifference and how it should never be accepted in any place.
And how did they respond to that?
I feel like the parents were ashamed.
Yeah.
Because I remember mum telling me there was a few parents in there that didn't know where to look. Because,
it's taught.
It hurt some home truths. And our Angela, she's not going to be silenced. So I'm so glad she taught me that. And I was there to witness that, because not only did she do her job as a mother, she showed me what it was to be a strong woman, to stand up for what you believe in.
I love that.
Yeah.
What an inspirational role model.
Yeah.
Yeah.
And even though for her, she was just protecting her little baby, like you would, for us as the young, we look at you like, wow, that's what I want to do.
Yeah. Fearless in a way.
Yeah.
Yeah.
And that's one of the very pivotal moments that I will never forget in my whole life.
I can imagine.
So I think that's why I went into performing arts, because you just be yourself. You can put makeup on. You can put these fancy glittery costumes on because you are a character. You are a performer. You're not your own self. You step into a role. So I think it was a form of like escapism.
I get it.
And for many years, even when I went to high school, I was the only Chinese girl there. So again, I was really racially bullied. I just felt like I just didn't belong there. And I acted out. I just became very like, I just didn't like school. School was just not me. I'm not an academic person, you know? So I became the class clown and my grades dropped. Now my mum and dad had nothing growing up. They came from literally nothing. So they sent me to private school and they saved up. So for them it was, you know, in Asian culture, come on.
Yeah.
It's time to shine now. Come on, get the academic side out. Me, I was like, I don't understand.
Yeah, this isn't me.
This is not me.
Yeah.
So I think.
So was that difficult for them and I guess difficult for you?
Yeah.
Okay, so how did you navigate that? How did they navigate it?
My teenagers were a really rocky time.
Yeah.
Like I fell out of my mum a lot. And
because she was pushing you in academia and you were pushing back.
Yeah, but also she wanted me to follow my dreams, but not be misguided.
Yeah.
In the, you know, the academic side wasn't important. But I was so kind of lost in my own way and I fell into my little shell that I just became the class clown. I ended up on a report card. I was, you know, on the edge of getting expelled, things like that, and not going down a great route. But the dance side, you're excelling.
Yeah.
You're doing amazing. So I think with my mum, she could tell that I was kind of going through something, but it was more me internally having a bit of a like identity crisis. Even that, I think that's a very strong word, but now that I'm older, I definitely was going through an identity crisis.
I get it.
Like I used to wear fake tan, smother myself in tan. I used to want to bleach my hair. I used to want to draw my eyes so they weren't as like cat-eyed. I used to, just westernize myself. So then I wasn't like a big, I don't know, I didn't stick out like a sore thumb.
I get it.
And I don't know if you ever went through that yourself.
Or when you're saying this, I'm nodding along because I remember in my English literature final, I wrote you have to write a piece. And my piece was called Identity Crisis, the Culture Clash.
I just got shivers.
So that, it was just after, like I said, after 9/11, I remember walking in the streets and being told to F off back to my country. And I remember looking around going, what? Where do I F off back to? Where does
I'm
this
in
mean?
my country.
You know, bear in mind, I'd never been to where my father was from or where my mother was from. So it was a real shocking moment for me.
Yeah.
And then I realized, okay, if something happens, the first thing that does, unfortunately, happen in our society is fingers are pointed. And if you look different or other, then you are more likely to be victim of racial abuse.
Yeah.
And it's one thing saying things, it can also become violent, physical abuse, women wearing scarves.
This happened when the pandemic happened.
Yeah.
So obviously because the pandemic...
Yeah, people said it started in China.
Yeah.
Yeah.
So your girl's Chinese.
Yeah, so suddenly...
I mean, I'm sorry. It's not. I was in Manchester at the time.
I didn't bring COVID into the...
anything.
That's awful. That is so bad. Yeah, so what did you experience?
Just so much racial abuse.
Yeah. I mean, that's propaganda though, right? Because the media has a large part to play here. The way that it was presented in the media was Chinese illness, Chinese virus.
Chinese of everything.
Yeah.
But where's the proof?
I know.
You can't just label it all.
Yeah, it's very interesting how, like you said earlier, racism is taught, hate is taught, fear is taught. You don't fear. If you look at children, my kids, for example, they'll go up to a spider. Absolutely.
Yeah.
They'll jump off things. They have absolutely no fear in touching and exploring things because they have not been taught to fear that.
Yeah.
And so I'm dogs as well. I'm really mindful to not project my fears on them around spiders or around dogs. And my husband's really amazing at it because he's a child and adolescent psychiatrist. So when they're like holding spiders, I'm like biting my tongue and just like edging away slowly. But that's the reality, right? So fear is taught. And where does hate come from? Where does racism come from? It comes from the stigmatization of a negative assumption that is propagated by fear and fear of other. And therefore you learn to hate. And that has been throughout history. And this is a topic that I'm really, really passionate about because I think if hate can be taught, then love can be taught too.
Of course.
And if you've been taught it, then you have to unlearn it. And when my son was bullied, my daughter was bullied, I also had the same things going into the school and saying, well, actually, these things need to be, it comes down to the teacher because it's not the child's fault. The child is 5, 6, 7, 8. They're hearing it at home. And
then coming to school and
emulating that behavior. They are repeating what they heard at home. But change has to start, and it has to start somewhere. And we have to go down to the grassroots and have these difficult conversations. And the way that you do it is beautifully. But I think that's where, your mom storming into the school, me storming into the school many, many times, unfortunately, I hope has made an impact.
I think it has. From someone as a child who saw my mum do that. And obviously your daughter's not an age where she can be like, Mum, I remember when you did this. She's still learning. Yeah. I can tell you hands down now, hand on my heart, that will show your child strength and, like I said, fearlessness and also knowing when to stand up and speak for not just your own self, but for other people who are affected.
Yeah, exactly.
Because I always feel like if you see racism and you don't say anything, you're just as bad as the person who's racist.
Absolutely. Silence in the face of oppression is awful.
Yeah.
I hope I teach my children the 3 C's. I say competence to navigate life, confidence to stand up for what they believe in, and courage to be true to themselves wherever they are.
They've got such a strong mama.
Oh, thank you.
And honestly, I just think you're an incredible woman.
Thank you.
Round,
so are you. Well,
with empathy and in your professional life, your personal life. I just think you just know how to navigate situations that are with love and not with just force.
Thank you, my darling. Thank you. Well, I'm inspired to be around you because you lead in the same way. Tell me then. So you became a dancer and that was your escapism and you were performing. And then how did you get into fire breathing? Is that what it's called?
Yeah. So
I've seen some of your videos and I'm like, oh, I die watching them.
No. That's your mum mode coming in. That's my mum was like that. She's like, can you not do something else?
Yeah.
It's not too late to go be a doctor. Please. I was like,
no,
it's a bit late now, mother.
So
I think once you learn a skill set, you want to learn another skill set.
Sure.
And then you want to keep broadening your knowledge. And especially I found myself as being a niche in my looks. That was the first time I was like,
in your power.
Yeah. I was like, this is good because I'm actually getting noticed because I look different and not being victimized because I look different.
I got it.
So obviously you got to take the reins and you're going to be like, I need to capitalize on this. So I just did everything.
So how far can we go? So you went down the fire?
Yeah.
Okay.
Basically I became a dragon.
Okay. So what is fire breathing?
So you have paraffin in your mouth and you have 2 sticks, which are, they're fire sticks and they're lit and you basically spit the fire out and you have to spit it out with force. So then the fire will...
Is it spitting or is it blowing? Like you're blowing out this gasoline. Okay.
Does that make sense? So it's like blow, kind of spit, blow.
Yeah. Okay. And then it looks like you're fire, but you look like a dragon.
You look like a dragon.
And so you did that for a long time before the accident?
Yeah, a few years. And so, but do you know what? I look back now as well. And I think I'm, in a way, grateful that this happened to me when it did. At the age of 22, this accident changed my whole perception of not just myself, but also who I can be other than this character. Because I think up to 22, I was living under a mask of being a performer because it was safe. It's a safety blanket. When you're up there performing, you're not being asked these questions. You're not being scrutinized by how you look. You're just there.
Yeah. You're in character.
Yeah.
You're somebody else, really.
But I think it was good that this happened because how long can you be in character for, girl?
Yeah.
So this made me see my true potential in other ways, not just from performing.
So do you feel, although it was a horrible accident and it was a traumatic one, do you feel that it started you on a journey where you were able to take that mask off?
I had to. It was gone. If anything, I was burnt in my face and my mask was my face. Does that make sense? The makeup of performing.
So what happened?
Was the mask.
Tell us about that night.
So I was blowing fire at a charity event, and this was in Chicago. And I did all my checks and everything, and the venue must have got hot. So they turned the aircon back on, but didn't turn it off when I came on stage. So when I blew the fire, the wind from the aircon blew it back in my face and set me on fire, basically. And from that, because it was a full thickness burn, at the time I didn't know it was going to be a full thickness burn, but you learning about skin, that's already perforated through so much protective layers of your skin, of your, fat layer, things like that. Like it's basically where the cells just cannot heal themselves. And you either need a skin graft, you either need other things going on. The fire brigade was called. The US military was called. The police was called. The ambulance was called. And I went through, I think you go through a moment in your life where you just think, this is survival mode. First time ever. And it's so mad to have that experience, because I can't even explain what that experience is. You just go into, I know it's cliche, but it's just kind of like the whole world stops and you're just in motion. You know what I mean?
I know exactly what you mean.
Yeah.
And it's, I think, I treat quite a few burns victims from various different types of burns, chemical burns, fire burns. And they are treated slightly differently, but the reality is, and of course it depends on where on the body we're treating. There are areas that become very tight, like the abdomen.
Yeah. Even like here. So this was where the main burn was, on my neck. And they were, when I was healing, they were like, Sophie, you cannot sit like this. You cannot sit with your neck forward because it's going to restrict.
Absolutely.
And I was like, but it hurts. Yeah. They were like, you have to have your neck back like this.
Yeah, you need to tense. Yeah.
And they were like, no. Anytime I have my head down, no.
Yeah.
Because they're
trying to stretch, of course.
Yeah,
stretch. So you were in hospital in Chicago then?
Yes.
Probably one of the most expensive places in the world to be caught up in an American hospital.
I know.
So what did that look like then? But you were very lucky because you got access to some incredible surgeons who were performing quite novel work. Yes.
So this is why I say I think everything happens for a reason.
Yeah.
Even though this happened to me on April Fool's Day, 2018. This is also Easter Sunday. Now, I've never been a fully religious person, but I believe that I was resurrected as someone else, or the old me was gone.
Yeah.
And to me, it meant something. The burns unit where they treat the military is that burns unit that I got sent to in Chicago. And it's the leading burns unit in America.
It's like it was meant to be.
Yeah. If I was going to get burnt, that is the place to be.
Yeah.
So when I came off stage, I had like a damp towel, but they brought me this. You're going to probably cringe now because
they brought you ice.
Yeah.
Yeah. It's the worst thing to do. Actually.
Straight onto the burn.
Yeah. You should never put ice on a burn.
Damp towel.
Yeah.
Always. And it gave me another burn. So obviously I had a fire burn, which was already full thickness, and then an ice burn on top of the raw flesh.
Yeah.
So that's killing
There isn't
more
much
cells.
education around proper burns management. And you'll find that as soon as somebody gets burnt, even if it's a small burn, the first thing they do is look for ice. Yeah.
It's an ice burn.
Yeah.
That's why you get...
Exactly. Yeah. So please, guys, if you or your children get burnt, actually, no, you
just
need to go.
Towel.
Yeah.
Just a wet towel.
Exactly. And lukewarm to cold water, but not freezing.
Never freezing.
Never ice. Go on.
Yeah, they put freezing water on me. And then when the ambulance came, what are you doing?
Yeah.
Why have you done that?
Yeah.
Because obviously people at the venue were like, right, okay, we need to...
Panic mode. They went into panic mode.
Yeah. I think fire. What's the thing to cool it down? Ice.
Yeah. Yeah. Incredibly painful as well. Incredibly painful.
At this point, I think I was numb.
Yeah.
At this point, I think I was like, listen.
You lost sensation because it was a full thickness burn.
Yeah. And over the course, like, of that next 24 hours, that's when I was so swollen. And because of where the burn was, my burn's here. And basically where it is near my esophagus and my face, you know, as soon as you get a burn, it swells to try and cool down the burn area. That is what the body does. So when you have a blister, do not pop it. I always say, why are you popping the blister? The blister is there to keep it hydrated and to protect your skin. If you pop it, it's going to dry. And then you'll get left with a mark. So if you have a blister, keep them. It's your body healing you.
There are very rare times when we would de-roof a blister. But yeah. So then what? So you went to the hospital?
Yes. And I was on fentanyl. That's strong stuff. That was some very strong stuff.
And you were alone, presumably your family were not around.
So my family were there, but I just needed to be by myself.
Yeah.
So I was just like, please, everyone, just like
go.
Yeah. I was so heartbroken because in one day, I lost everything.
Yeah.
In one moment, I lost everything. Near enough lost my life as well, you know, most importantly. But I lost everything that I'd ever known. My identity, you know, my job, everything that I'd worked so hard for. And when I woke up, I was so swollen. I couldn't see. I couldn't breathe. I couldn't do anything. I couldn't eat, couldn't do anything by myself. And that's when they said, you know, you're starting to come round. We need to disinfect the burn. We need you to shower because obviously it's been a few days now and you're starting to come round. So they gave me this really strong medication before I went, like a painkiller. And then they wheeled me in a wheelchair because I couldn't have balance because my face was so swollen. When your head's swollen, I literally like a bobblehead. You know what I mean? I was not in a good way. And they wheeled me in. It was like a morgue. Like, it was like a metal slab. And I was just knelt there. And they used this scouring pad and alcohol and just scrubbed everywhere.
Presumably you were numb.
It was kind of numb, kind of not.
Yeah, I get it.
You know, it was like the main thickness burns were numb, but in and around, oh my goodness, I've never felt pain like that in my life. And it's like hurts your heart pain.
Hurts my heart to hear it, let alone what you must have gone through.
And when you're there, I remember I was knelt there. Obviously, you've got no clothes, nothing.
Yeah.
This is the first time you're so vulnerable in your life. And there's just bits of you going down the drain. And that was a real wake-up moment of like, and I was crying. I remember I was crying. I was just like, please, God, please let this be a new beginning, a better beginning, and let these old pieces of me leave that don't need to be here.
What a powerful thought.
Yeah. And I remember I was crying. Like my tears were just falling along with my skin and bits of burnt hair, bits of burnt me. That's a real life vision of the old you leaving you.
Yeah.
So I think it was kind of from that moment on that I had to delve deeper into who I am, not just what I look like, what I am from the outside. Because the outside now is burnt, you know, you've got to heal. But the inside has got a lot of work to do. You've been covering a lot up from the inside out for many, many years. And over the course of the few days, you know, I remember they wheeled me back in. Like, I looked at my face. I told them to take all the mirrors down. I just couldn't look at myself because I didn't know who that person was.
It's your identity. When it's your face, you also can't cover it up, unlike injuries elsewhere. Yeah. It's visible for everyone to see. Yeah.
And if that's your whole life that you've ever known for you to look like this, and then it's a completely different person. Someone that I look like I've literally been beaten up. Like beaten up really bad. And I just felt useless. I felt ugly. I felt so low beneath myself. And I felt like I had no purpose because my purpose was to make people feel happy and perform. I can't do that. So what am I here for? And I'm not going to lie, you know, you do throw yourself a bit of a pity party.
Yeah.
You are going to be sad.
Of course.
You're going to cry.
I think you'd have to be some kind of superhuman if you didn't.
Yeah. And I went into a really dark place there.
Yeah, can imagine.
They sent me a priest. This priest had to pray for me. And, America is very big on religion and that aspect of things. And so when this priest came, I remember he said something. He was like, I'm not here to push the word of God on you, because at that point I wasn't very religious. And I think I was still very lost.
Yeah.
I was so lost. I was just, I don't know where to turn to. I don't know what I can do. And he was like, I'm not here to push the word of God on you. I'm just here to remind you of your light. And the light is always within you. No matter how dim or bright you want that light to shine, it's always within you. And so right now, the light's a bit dimmer. And that's okay. But when you shine bright, you will feel the true beauty of life. And I think that is so important. And I understand that now. Then I was just like, what do you mean there's light? Yeah. I was like, where is someone show me the light?
Show me
the light, because this is dark. And I say that line to a lot of like the school children, young people that I meet, because I think they don't understand their own light and they're yet to discover it.
Yeah.
But they just need someone to believe in them that they have it. So from this, it brought a whirlwind of emotions that I'd never felt. So like I really had to think about my identity, think about the legacy. If I left a legacy behind, who am I? Have I done something that's made me proud? Have I done something that's made my family proud? Have I done something that's going to make positive change and impactful change for generations to come, not just for me? And my answer then would have been no. My ego wanted to say yes, because Sophie Lee, the performer, well, yeah, you've done this and this and this, and you've looked cute and you've been pretty, you've done that, like, but that's all very surface level. Really, I was inside I was a hollow shell. And I think we touched upon this when I was saying, like, when you're young, you're a seed. Yeah. And this seed is the purest seed in the world, because you've had no information, no watering, no nothing. So anything that you learn, education, love, hate, everything, all impacts how this seed is going to grow. Absolutely. And so I felt like I was in a stagnant place of growth. And that seed needed new water, needed new education. So profound. I love it. And I think it was time for me to make a change, because everything that I was watering myself with, it wasn't anything that was going to help me grow to be the best woman that I know I can be and that is there. So do you feel that for you it was a spiritual awakening? 1,000%. I can hand on my heart tell you now, it was definitely, I feel like God gave me a second chance at life. And it's very, very rare you get those chances in life, especially to become a better person. Yeah. And in a way, relearn who you are. Because there's a lot of the times when you do have these epiphanies and these spiritual awakenings, you're further down the line. And you've got children, you've got bigger things that you need to think about other than yourself. So at 22, I think, even though it was a young age, it was the perfect time for me and it was meant for me. Hearing your story makes me think, and I'm not at all dismissing or diminishing the trauma that you went through, because I know it was traumatic and you're only touching on it. You're such a positive person. And your healing journey was quite a long one. You developed tumors and hypertrophic scarring, and we'll talk about that. But I can't help but think you are very blessed and you're very lucky. And I know that you have said this about yourself as well. And you say, because actually it is not just a spiritual awakening, it's pivoting, it's finding a new purpose. So many people walk through life without purpose, without understanding their why, what they want to
leaving this world, because there's only two things that's guaranteed: taxes and death. Yeah, you don't even know. You can't control when you're born. You can't control when you're dying.
Oh, girl, I know.
But the in-between, I say this to my kids all the time, you've got a responsibility as a vessel in this world to bring light. And when you were talking about darkness and light, what's really interesting, I was thinking about when I was in school, when I moved to Oman, I had a British military maths teacher who was super strict and super scary. And he would make you stand up in the middle of class and give you 3 seconds to answer a maths question. If you didn't get it, you were sent out of the room. And I used to be terrified of him.
Yeah.
And at the end of the year, in my yearbook, he wrote, the light of a single candle cannot extinguish, all the darkness in all the world cannot extinguish the light of even a single candle. And I remember reading it and thinking, what does that mean?
What are you on about?
Yeah, like...
Can you not just say good work? Good luck?
Well done. Yeah, you didn't get chucked out of the class. You learned your times table. I remember thinking, all the darkness in all the world cannot extinguish the light of of a candle. I just didn't get it. Like it sat with me, and I read it and I read it and read it. But I was 9,
This is it.
I didn't resonate. I didn't quite, but it stuck with me because I thought he's trying to tell me this is a meaningful statement, but I don't know what it means. And then years and years and years later, and probably now, so we're talking nearly 30 years later, in all the darkness that's going on in the world, I keep thinking I need to show up as light. And that statement keeps coming back, and I found it recently and I opened it. It's like however many, almost 30-year-old book. I opened it and I saw that one line, all the darkness in all the world cannot extinguish the light of even a single candle. And I thought, that's what he meant. That's what he meant. And it's so powerful.
Way.
It's so powerful. And so what it means is you are responsible. It doesn't matter what's going on out there. It doesn't matter all the darkness. It doesn't matter
There's always going to be that, but how you show up.
How you show up, what you bring to you can still create light. You can still bring positivity. You can still make a stand for humanity. However you want to interpret it, in whatever context, you still have hope and can give hope to others.
Of course. And I think a lot of people think, doom and gloom.
Yeah, nothing I can do about all the darkness. Might as well just join in it. No, that's not true.
I was that person.
Yeah.
I was like, why me? Why? Why this? Pity me. Blah, blah, blah. And instead of the why, I had to turn that into how. How am I going to be the best me? How am I going to do better? How am I going to become this woman? And that's kind of when the light clicked. Because it was no longer darkness that I was thinking in. I was thinking in the light. I was thinking in, okay, maybe I'm not able to do that now, but that's something I want to aspire to be in the future. Like going to schools. That was when I learned, like, look, there's probably some kids out there that need this little bit of snippet of real life, that this can happen in 10 years, 15 years, tomorrow, that your life can just
change in the blink of an eye.
Yeah.
And what are you going to do about it?
Yeah. Because for me, I didn't think, no one ever thinks when they grow up, I'm going to be in a crazy accident that's going to nearly take my life. And then I'm going to have to rebuild my life fully.
So I want to take you back to that. I know it's a difficult journey. I want to take you back to that because you had this priest come, and I've heard you talk about this before, and he gave you this hope, so to speak, and a purpose.
Yeah.
But your healing journey was a long one. It wasn't an easy one. And because of your Asian background, I'm Arab, because of our skin type, there are variations that will respond to trauma in different ways.
So different, isn't it, from how you see other skin types react to trauma. You just think, that's crazy.
So talk to us about the type of tumors that you developed after.
So I actually when I came home to England, I actually got misdiagnosed for a year. They thought it was a hypertrophic scar. So that's just when it's just a little bit raised. And that's all it's going to be. And then it'll be dormant. No.
This continued to grow.
This grew like bulbs, like really strong, like they look angry on my face, and it was like growth on my face.
I've seen them. We'll put a photo up for patients to see.
Yes. And
was that slow? Was that a slow growth or a rapid growth? Over how long?
It was like within 3 months, they'd gone massive.
And nobody wanted to touch it.
Yeah, because
nobody knew how to deal with it.
Because now there's no cure in the world for keloid tumors. Great. That's when I got diagnosed with a keloid tumor.
Yeah.
And I was like, and they went, yours is one of the biggest ones we've ever seen. Great. And they went, and it's in a really difficult place. Great. I was like, anything else you want to tell me while I'm here? Because my heart's hurt.
Yeah. And you can't hide it, and you can't mask it, and you can't wear makeup over it, and you can't,
Keloid tumor is one of the most angry.
Yeah. And was it painful?
So painful. The medications they put me on were crazy. I'd be on medication for epilepsy. At one point, my medications would put me to sleep for like 2 days because the pain was literally like stabbing in my face. And because of where it was, you can't just cut a keloid tumor, it'll grow back. I was like, great. Can we just slice it off?
Because that's the initial question, of course, is can you remove it?
Yeah, and obviously at this point, I was so early in my journey, I didn't know anything about skin barrier, the skin texture, skin differences. I just thought, we just chop it off, grow with normal skin grows back, and I go back to my normal life.
Yeah.
They're like, no, girl.
No.
You better sit back down because you're going to get educated.
Strap in. This is a long journey.
And they said there's actually no cure and no surgeon in the world. They opened up this case globally, internationally, because obviously they reached out to surgeons who were in Asia, because I'm Asian, in like Korea, China. No.
So how did that surgeon, because there was somebody in the end that was willing to operate.
Charlotte Defty. She's actually in St. Helens.
Oh, wow, I didn't know that.
Down the road, girl.
Okay.
Yeah. And it's actually so crazy because I feel like this whole story is a 360 moment and you'll all be like,
yeah,
this was written for her. This whole journey was written for her. She's the only woman in the minute that can perform this. And so she said to me, I've not seen something like this ever. It's so big on your face. And she told me the process of interlesional cryosurgery. So this is where they inject liquid nitrogen into the keloid tumor and the process of freezing happens. So it's frozen to minus 100 degrees. Essentially, it's the method of like how you would freeze a wart, but on a much bigger scale. And then the process of necrosis happens. So this is where the skin tissue dies. So you see, guys, I'm a little bit like,
you're like, I'm a scientist now.
Yeah.
Mama.
Yeah.
came back.
I may not got the grades on paper, but your girl can talk.
So necrosis is cell death, but this is a controlled necrosis.
Yes.
This is where they were using cryotherapy, which is freezing the cells to the point of death in a controlled manner in order to stop the tumor from recurring.
Yes, so instead of just freezing it and cutting it, they had to really gently inject it to make sure that it was so intricate around the tumor as well. Because a tumor has its own blood supply because of how much the skin cells have wanted to heal the body. And that's where
goes into overdrive.
Yeah.
You're like, check me out.
Yeah,
and did you have to go under multiple rounds of that? So that was here in Liverpool.
Yes. So this happened at St. Helens Hospital, and then I went into recovery at Wythenshawe. And I was terrified because they were like,
we don't know if it's going to work.
Because I basically to have any of this, I had to agree to be in a case study.
Yeah.
And it's the only case study at the minute. So I'm there like, can I email anyone about this? Because I don't know, I was going for them. Yeah. And they were like, there's no one else. I was like,
great.
Great.
So you're the leader.
Right. But being the leader is so scary.
Yeah, because it's a lonely place.
Yeah. Because I'm there like, can someone come with me? And they're like, no, it's just you. And obviously when you sign over you agree to these things, there's chances of death. You basically sign your life away. You basically like, okay, whatever must needs be, you make the decisions. Your life is no longer your own choice. And that in itself was so scary.
Absolutely, I can imagine. So when was that?
That was in 2019.
And is that when your healing journey started? Because honestly, looking at you, Sophie, most people wouldn't be able to tell that you've had a burn.
Thank you.
The scar tissue, the way that it has healed, the fact that you haven't had extreme limitations in mobility, you're able to rotate your neck fully. Correct?
I didn't.
There is a reduction in your ability to extend, but the way that it has healed, and remember that scar tissue continues to contract and evolve and mature over time. This is just the beginning, really.
Yes.
It's incredible.
Thank you.
It's incredible. And that isn't just because of the doctor's work, and credit to Dr. Charlotte and all the medical team that were involved in your care, because without that, you wouldn't be here today. But that is also because of your compliance and your hard work.
Yeah, you have to. I bet you tell this to your patients all the time. I do 50%. The rest is up to you.
Yeah.
How you end up, how you aftercare yourself, is down to you.
So when did you start going down the path of, you then healed, but when was this the point where you thought, okay, now I want to start to try and do something more for my scarring? Was that available on the NHS? Did you go privately? And how do you feel about aesthetic treatments in general now?
So this process was on the NHS, obviously because it's of research. And I'm so honoured to say that from my case, they've now been able to recognise this as a breakthrough, you know, in medical science, that there is, in a way, a cure, and in a way to retain such an angry and such a I don't know how would you even explain a keloid tumor? Such a
uncontrollable multiplication of skin tissues that is
unexplainable.
Unexplainable
until it happens.
Yeah, very difficult to treat as well, because you don't know the end point.
Yeah, and are you making it better or are you making it worse? So from this, they were able to offer this on the NHS for many more people now.
Wow.
And that to me was, if I died on the table, at least I'd done something.
Bless you.
You know, that was my way of being like, I reflected back to how I was in Chicago and I was like, if I left the world, have I left anything that I'm proud of? Then would have been no, and now would have been yes.
Yeah.
So
what treatments did you have access for improving the scar tissue?
So I had to wear a compression mask and then I had to have a second round of surgery. Then when the skin tissue, by the way, I had to do a lot of massage, a lot of loosening my face, a lot of looking after my face. I couldn't be in the sun. So that's what I mean by aftercare, is also in respect of the work that you've done. You know, because it would have been a slap in the face to my surgical team if I just went home and did nothing. Yeah. Because they'd be like, well, we've done all this work and you've literally not listened to us or helped.
You're honestly the ideal patient, Sophie, because you listen and you do follow all of the aftercare, the protocols.
And she goes, because my surgeon's a woman, she gets it. She's like, girl.
Yeah, I understand.
If you want the end result, we've got to put the work in. Just think of this as a facial. Just think of this as the best facial you're ever going to get, and it's going to change your whole life. Yeah. And I was thinking, perfect. This is what I need. So then I had steroid injections. Yeah. And unfortunately, they stopped working because there's only so many rounds of that you can take. Yeah. So then that's when they said, we're going to have to put you on 5-FU, which is a form of chemo. Yeah. That devastated me, you know, because I got so weak. I was really tired, and my hair was really thin at that point. It was just, I was not falling out in clumps because I was just getting it injected, but it really, it did really mess with my health.
It's a strong biologic that can really impact, just biological function. Absolutely,
it threw everything off. Yeah.
But they were trying to get the tumor to stop growing.
Yeah. It threw my whole body cycle off. Yeah. And as a woman, you know, I was just like, I don't know what's wrong with me. Yeah. Why am I so hormonal? And then why am I crying? And then why am I like, yeah. And again, like, I don't know who I am. Yeah.
So how did you go from all that to becoming an author and a motivational speaker? How did you have a mentor? Did you go in a leadership program? Did you find God? Did you read the Bible? How did you go from wearing a mask to not just taking off your mask, right? But helping other people to find their power?
So I haven't done any of that.
Okay.
I think the one way that I knew I could help in my most raw time was just to be open, honest on my social media platform. And I had no following then. I was under 1,000 followers then. But because of the severity of this case, and obviously people saw the state of where my skin was, how it was going, I knew that if I was in this position, someone else is in this position. Where it may not even be to the extent of this, but someone just, if I can help one person, then that's me changing the world.
Yeah.
I've changed one person's world.
Yes.
And that to me is all I could ever ask for, you know? So I started talking really openly about it. I started making videos. I still kept my sense of humor. I didn't want that to diminish who I was. Like, even though I'm going to have sad days, crying days, you know, days where I'm just eating Ben and Jerry's, crying. No one speaks to me. I don't exist, you know? And then there's some days where I'm like, no, this is who I am. I want to still be me. I'm not going to ever change me. I might not feel like me at all times, but in the core of me, I know my values, I know my beliefs and my morals, and I'm going to stick to those, but I'm going to share those in my own way. So that's when I started creating a lot more content online, and that's how I grew my following. And that's, in a way, how I came to accept my situation as well, because I was talking so openly about it, even though at that time, the forefront of my brain and my mind was focused on helping others. Unknowingly, it helped me. It really helped me heal.
I understand that.
Yeah. And then from that, that's how I started to work with people like yourself in the medical industry who work not just aesthetics, but who sees all different patients. Because obviously at one point my face was so heavy. The scar tissue really dragged a lot of my face down. And I had a keloid tumor on my lip. So I had filler in my lip, on one side of my lip.
Yeah, to even it out.
So I've always been open. Because I don't want people who've gone through trauma to think that little treatments that even if you just have filler on one side of your face to even the other side, you don't need it in both. You don't need to have a full face done. You know, it's for yourself. And it's not for anyone to ever question.
I agree entirely. So I had an accident when I was 8 years old and I fell and I cut my lip. I've spoken about this on the podcast before and I ended up with quite an obvious scar. And I was bullied about that a lot when I was younger. And so when I was much older, I had scar revision treatments in the form of radiofrequency microneedling and lasers to soften the scarring. And you know, if you look for it, you can still find it. You can see the scar. And sometimes people go, "Oh, you got a lump on your lip." Like, no, that's from my accident. And so often when patients come and they seek care, it's not for vanity's sake.
No.
It's because there is a burden that they're trying to alleviate. And this is also how they conduct themselves and how they carry themselves. This is their business card. You might not see what lies beneath the surface of their clothes, but the face is a very personal thing. And if you have had an accident of any sort or have craniofacial deformity, you can't hide that. And people somehow, for some reason, feel that they
feel
are
shame.
They feel shame, but also society is at liberty to comment. What happened to you? Why is it like that?
Do you know? Oh my goodness.
I forgot about it, but thanks for highlighting that.
I cannot believe you just said that, because one of the first things that happened when I came out of hospital in Chicago, my mum took me to a makeup store. She took me to Macy's, and I was at the Anastasia. It was when Anastasia Beverly Hills, the big brown thing, and she was like, "We're gonna get you new makeup. You know, you wanna whatever." And there was a group of girls, and she looked over and she goes, "What happened to your face?" And that was the first time I ever knew, like, I'm not in a safety blanket anymore.
I'm not in a safety blanket. And then you're put into a position where you have to explain what happened to your face to a complete stranger. Fine, I understand the psychology behind it, but it's a very difficult thing to go through.
Yeah, because even up to then, it was, why do you look like that? And I'm Chinese. Nothing had happened to me. And then now that something's happened to me, it's like, what happened to your face? I'm like, guys.
Come on.
I need a day off. I need a day off.
One day. Come back tomorrow.
Just one day.
But you know, interestingly, that became the trajectory and my why. You know, like that's what sparked my interest into facial aesthetics. So in a way, I know that this like changed your trajectory.
It resonates.
So I do believe that everything happens for a reason. Talk to me about your book, In My Skin. What is that about?
In My Skin basically covers everything we have talked about, but on a level where it's also a self-help book. I don't want you to think that my life has been rosy, this, that, and the other. And I got given the best team of surgeons, and I got given this, got given that. It talks about everything. I'm telling you, everything that has been hurtful, I'm so open about too, because I think you have to hurt to heal. And it's only on our weakest days we learn how strong we are. You don't learn how strong you are when you're just like, oh, I went shopping today. I was really happy. You know, those are your grateful days.
Yeah.
But the days you're broken, the days that you have nothing left to give, those are the days where you see your true strength within yourself.
This is true.
And a lot of people, I think, are scared of that. But that's where growth happens.
So this book is for anyone who has
anyone
and everyone.
Yeah.
Right. I need my copy.
Yes, I'm going to fully send you a copy. Anyone who's going through something or scared about the next chapter of their life, unsure about some things, it talks about, knowing your self-worth. It talks about rebuilding who you are. Because I feel like, so I'm coming up to a birthday.
Oh.
And every time I come up to a birthday, I reflect on my life.
Yeah.
I reflect on who I am as a woman right that moment, how far I've come and what I'm yet to be. And this year, I'm going in my last year of my 20s.
Listen, girl, life begins at 40s apparently. I'm waiting. Let's see. I'll let you know.
I've got another 10 years. I'm really like, what do you got for me now? What is there left for me? And this year I was just like, who am I? Am I the woman that I want to be? And it's exciting because a part of me is like, yes, I'm becoming that woman. But a part of me is like, I've got so much more to give. And I think even like for me, I did, when I went through my accident, I did stages of celibacy. And that was really important for me because that eliminated any distractions in my life that were distracting to my worth. I think when you're running around chasing boys, doing this boy, that, finding a husband, you forget that like you're you first.
Yes, absolutely.
You're not going to attract your partner if you're not you.
Yeah.
You've got to work on you.
Yeah.
So you attract what you want. And those few years that I did that, wow, that healed my soul. So now that I'm in a place where I'm just fully myself, I'm like, I'm ready for more of me.
What is next for you?
I feel like I'm on a path of helping to create change. And I'm at the start of that path. I feel like there's so much more to give. Being in schools exhilarates me because like I said, these young adults, they're just the seeds. And I'm so honored that I could be a part of their journey to water them to become amazing individuals. And I hope that if they take one thing away from my story, it's the power of resilience and how much it is it's pivotal to know when resilience is going to save you from yourself. Because I think a lot of people give up. But if you just have that little bit of hope, a little bit of patience, then you've got resilience.
It's such a powerful and important message. Thank you so much for sharing that, Sophie. One thing that I didn't ever tell you was when I was 15 years old, I was caught in a house fire. I was asleep when my house burned down. And I am very, very lucky. I don't know if I shared this with you before. I'm very lucky to be alive because I am one of the rare people who smelt the smoke and woke up to find that the house was on fire. And managed to escape. And I mean, like the ceiling caved and the windows broke. And it was a pretty traumatic house fire. And I managed to come downstairs and I remember turning around, looking at the whole lower floor and flames, thinking, how do I put this out? And when I opened the door and I screamed for help, there was a moment where I had to run back in to look for my younger sister. And later on, the fire brigade said to me, how did you smell it? Because most people fall asleep, they don't smell it. They die in their sleep from smoke inhalation. And I always get quite triggered when I hear stories of burns victims. I recently went to an event with Katie Piper where they opened a new hall in Liverpool with one of my patients who is a burns victim as well. And there's one thing that I keep seeing time and time and time again. I remember bursting into tears listening to all the stories. But it's the overwhelming feeling of gratitude, of And it's an incredible thing, because actually a lot of people who have undergone trauma emulate so much gratitude.
I am.
Yeah, and that's what you have.
I feel like
it's this unwavering belief of thanks, a feeling of thanks for being here, an understanding of purpose, and giving back to other people. And the power of hope is not something to be belittled or dismissed. The power of hope is something that can heal. It can heal you from illnesses.
Yeah.
So I know that your book is going to give a lot of people a lot of hope. Thank you so much for coming on here and sharing with us.
Thank you for having me and sharing your life with me as well. I feel like we've had a little girls chat.
I'm sure we're going to chat more and more in the clinic. Thank you. I really appreciate it. If people want to buy your book, where can they get it from?
Yes. So you can now purchase In My Skin. This is also working with Kate Piper.
Yes.
As part of her Unseen series. This is now available on Waterstones, online, and also on Amazon. Yeah. So it's ready right now.
Amazing. Credit to you. Well done, Margot.
Thank you so much.
Thank you for joining.